Good evening. This is Dr. John Bennett broadcasting from Miami. We have another in the series of Parkinsonism Hangout Educational Series with Dr. Abdul Rana, neurologist and world-renowned Parkinsonism educator. And tonight, Dr. Rana is going to talk about shortness of breath in Parkinsonism. Good evening, Dr. Rana.
Hello, Dr. Bennett. How are you this evening?
Very good.
It's always nice to talk about Parkinson's.
Yes, it certainly is. I'm learning more and more. I didn't know anything about Parkinson's. I thought I knew a little bit, but I didn't know anything. Okay, we'll start off with a question. Why does shortness of breath occur in Parkinsonism?
Shortness of breath does occur in Parkinson's. It usually occurs in moderate stage Parkinson's, although it can occur early on as well. There could be several causes for shortness of breathing. So sometimes this is a symptom of wearing off when a patient is taking levodopa, and in the beginning of the course of disease, the levodopa works very well, but as the disease progresses, the effectiveness of levodopa becomes less, and then it starts wearing off. So that is the time when patients start feeling that their symptoms of Parkinson's are reoccurring, or they're coming back during that period of the day. So in those off periods, sometimes patients could feel short of breath. They are not able to catch their breath, and therefore they are not able to do their activities of daily life. In other patients, it could be an accompanied symptom in dyskinesias. Dyskinesias are excessive movements, which occur when either the medication is working at its peak in most of the cases, or sometimes they could occur when the effect of medication goes away. So shortness of breath could be an accompanied symptom with these abnormal movements, which are usually rocking type of movements. They are different than tremor. So these movements, in the beginning, they may not cause any botheration to the patient, but they could become bothersome, and therefore patients develop sometimes they could complain that they have difficulty catching their breath when they have a lot of dyskinesias. In other patients, it could be related to anxiety. Because of anxiety, subconsciously they overbreathe. So when they overbreathe, so they feel they are not able to catch their breath, and therefore they could become even more anxiety prone, and they could get a feeling of panic. And in some patients, this could be like a vicious cycle. A patient who has anxiety, they may not be aware of the anxiety. Sometimes it could be subconscious or a stress, so they overbreathe, and because of overbreathing, they could get hyperventilation syndrome. In those patients, they could have numbness around their lips or in their fingertips. So they start focusing or paying attention on the numbness. They get more anxious. They breathe more, so they get more numbness. So it's like a vicious cycle. It keeps on going: anxiety, and then overbreathing, then feeling shortness of breathing, and again. So this could become a problem for these patients.
What are the consequences of the shortness of breath in Parkinsonism patients?
Shortness of breath is a symptom which could be sometimes associated with life-threatening illnesses, such as coronary artery disease, or MI, or pneumonia, or any conditions related to lungs. So it is a symptom which is taken very seriously by the ER physicians or any healthcare workers, or even patients themselves, if they can't catch their breath, so they feel quite anxious. So it can lead to anxiety. It can lead to a feeling of panic, and these patients then may feel overtired because they are over anxious, and sometimes over anxious patient may pace around, and they may lose their energy, so they may feel excessively fatigued, and at other times they may present to ER. I had a patient several years ago who saw me a few months ago, and he was not due for his follow-up for a few more months, but he presented to ER, and he gave history of Parkinson's, but his primary complaint was shortness of breathing. So he ended up having a CT chest, echocardiogram, and chest X-rays, and then spirometry. So many investigations were done, and still the shortness of breathing was there, and they could not find any cause. So they thought he might have a PE because he was less mobile, he was sitting all day. So he went through the more investigations. So I have seen other patients who go through lots of investigations. They are subjected to EMG nerve connection studies because they are having numbness in their fingertips or mouth area. And sometimes they could be assessed for MS because they have sensory symptoms. So these patients then start avoiding social situations because they feel panic and anxious. So they try not to participate in family gatherings or go out, and sometimes they develop fear of exercise, which is a very important thing in Parkinson's disease. So these patients start avoiding exercise because when they do exercise, they definitely feel short of breath, and their pre-existing shortness of breath can aggravate their symptoms. So this is quite a symptom which can have serious consequences. And if there is no cause found, then this cycle of investigation seems to end never. They keep on going. They go specialist to specialist unless someone sees them and rules out all serious causes, and they have understanding of this symptom of Parkinson's, and then they can maybe relate this to the timing of medications if a careful history is taken, and they can relate that it happens in the wearing off periods or when the medications are acting on the peak, and we are sure after ruling out serious causes, then they can reassure patients. Otherwise, this can be quite disabling and overwhelming to the patient as well as the caregiver.
How are these consequences treated or addressed?
I think the first thing in these patients is to take a very careful history, relating this to the timing of the medications of Parkinson's disease or any wearing off periods, and also definitely one need to rule out important causes related to heart and lungs. That should be done, and if they don't have any serious cause, then slow and deep breathing is very important. And if this happens in the off periods, then addressing off periods by either adding entacapone or other medications, or decreasing the interval between the dose of medications could help. And if this happens during the dyskinetic phase, then addressing dyskinesias is very important. Also, patients should try to do some relaxation techniques. If they are smoking, they should try to quit smoking because that has serious consequences on health otherwise. Doing some aerobic exercises is also important, and that would build up the stamina of the patient. And I sometimes tell patients that if you can do a good amount of exercise for a good period of time, for half an hour or 45 minutes, then probably, and you don't pass out or you don't have any serious consequences, you don't develop any chest pain with it, so most likely you are okay. And although we do need these investigations, but reassuring these patients is also important.
Very good. Anything else to add with shortness of breath and Parkinsonism?
I think in these patients, working with their family physician or internist or a cardiologist if they have is very important, because these patients would definitely need some baseline investigation such as ECG or an echo or a stress test. And so there should be close communication between the neurologist, patient, and the internist or cardiologist, whoever is dealing with these patients in addition. And if patients have history of coronary disease, of course, then special precautions should be taken that shortness of breath is not labeled just to Parkinson's and the important causes are missed. It's very important not to miss causes of such symptoms which could lead to sudden or fatal consequences.
Very good. I guess that wraps it up for shortness of breath and Parkinsonism. All these educational Parkinsonism videos by Dr. Rana can be seen at Parkinsonism TV. Good night, Dr. Rana.
Thank you, Dr. Bennett. Good
Thank
night.
you. Thank you.